Even outside of a global pandemic, each year hundreds of millions of patients around the world are affected by healthcare-associated infections. The most effective way to bring this number down is simply by practicing good hand hygiene. There are lots of things we wear on our hands that can harbour microorganisms. So at NHS Lanarkshire, our policy is for clinical staff to be bare below the elbow. Broken or irritated skin can cause discomfort and make you want to wash your hands less. If this is true for you or a colleague, speak to occupational health, who can help. Gloves should always be single-use, because washing them with soap or alcohol-based hand rub isn't proved to kill the organisms on them and can affect their integrity. Also remember, hands wearing gloves can still get contaminated, both during use and when we take them off. So don't forget to scrub up when you glove up, and then again when you are done. If your hands are visibly contaminated, or you think you've been exposed to potential spore-forming pathogens, soap and water is required. A good hand wash like this should take between 40 and 60 seconds. But those seconds really do save lives. For more routine hand hygiene, a good 20 to 30 second alcohol-based hand rub is fast, effective, and kinder to your skin. What the World Health Organization recommends is that healthcare workers clean their hands at 5 moments. Before touching a patient, before clean or aseptic procedures, after body fluid exposure risk, after touching a patient, and after touching patient surroundings. All are important, but the ones that are missed most are before touching a patient and after touching patient surroundings. These might feel like lower risk moments, but they are actually crucial interventions and a big part of doing our duty to protect our service users, ourselves and our environment against the viruses and bacteria that are potentially breeding on our hands.